Hello, today we'll deal with the treatment of heart failure and we are looking at Digoxin. It's written like this, Digoxin, and this is a medication that we will not use as a first medication. We always start with other medications that I dealt with in the other videos, like ACE inhibitors, diuretics, and so on. Digoxin is used when the other medication does not work. And we need to treat the symptoms of this patient because the patient is complaining about severe symptoms of heart failure. And we have been given all the other medications that we are supposed to give, for example, ACE inhibitors, diuretics, and so on, beta blockers, and it does not work. This is the last thing that we can do, giving Digoxin. But this will not improve the survival of the patient. It will not prolong the survival as, for example, ACE inhibitors does. The only thing Digoxin will do is to reduce the symptoms of heart failure. So this is not a good long-term treatment. Just because the symptoms disappear does not mean that this is good for the patient. It's only good in a short time until we find out what to do. Okay? The Digoxin acts on something called sodium potassium ATPase. Sodium potassium ATPase. This is a pump that we can see, and it will act on the heart. Here we have the heart, and it will decrease the rate of the heart. So the heart will start to beat slower, and it will also deactivate the sympathetic nervous system. So sympathetic, I will just write sympathetic. So it will decrease that. Sympathetic nervous system is the stress response of the body, and it will decrease that. And also it will decrease the heart rate. When we are dealing with arteries, for example, it will decrease the vasoconstriction, which means that the arteries will dilate. So it could be a dilation, which means that the flow is better. For example, the flow can be better in the kidneys. Here we have a kidney. The flow in the kidneys will be better. The heart rate will be lower. There will be a vasodilation. The sympathetic nervous system will be decreased, and so on. These are just some of the effects of Digoxin. And therefore the symptoms disappear. We need to remember that Digoxin is excreted through the kidneys. And if we have a bad kidney function, then what will happen is that Digoxin level will increase in the body, because the Digoxin cannot be excreted because we have a renal failure, a bad kidney function. So this means that it's very dangerous if you give a lot of Digoxin and the kidney is not functioning, because the Digoxin will build up in the body. It will cause toxicity. Digoxin can cause toxicity, and what does toxicity mean? It means we have too much of Digoxin and we get side effects of it. And the side effects are, for example, fibrillation, ventricular fibrillation. Ventricular fibrillation. This is very dangerous. What can happen with the patient? He can die. So if you give too much Digoxin to a patient who has a low kidney function, you kill him. Okay? And Digoxin has a very narrow therapeutic index, we call it. If we have, for example, we have a span of doses. This is just a span of doses here. Let's say we have a narrow therapeutic index. This means that, for example, if we give too low amount of Digoxin, then we don't have any effect. If we give too high of Digoxin, then we have toxicity, so side effects. And this span here between having too low or too high is very narrow. Other medications maybe have this amount of span, that you can play with the doses without having so much problems with the side effects. But in Digoxin, this therapeutic index is so narrow that it's very, very easy to get above the level which is getting side effects, which is ventricular fibrillation, which can kill the patient. Remember this. And which are the doses that we're dealing with? The doses that we will deal with is 0.125 to 0.25 milligram of Digoxin, and we will give this once a day. So you give this once a day, so per day, for example, in the morning. This just means that we have morning, lunchtime, evening. So you will give 0.125 in the morning. And as we said, please start with the lower doses because the therapeutic index is so low that it can be dangerous that we give too much of it. So instead, try to give 0.125 milligram instead, once a day, and in 1 week, so in 1 week's time, you will reach the target doses of digoxin. So it takes 1 week. So you give this 7 days, and then you reach that level. That is good for the patient. Of course, you can give higher doses if you want to achieve a quicker response, but this is not advisable in heart failure. It's only advisable when you have, for example, ventricular atrial fibrillation, not ventricular, atrial fibrillation. Then usually we give higher doses quicker, but that's dealt in another video. Here, in heart failure, it's more than enough to just start with 0.125 milligram once a day, and you will reach the level in 1 week. And please, don't stop this medication quickly, abruptly, because this is very dangerous. So if you want to stop the digoxin, you need to stop it slowly. Okay? Don't just remove it from one day to another. Slowly reduce the doses of digoxin, because otherwise the patient will come to the hospital again. Good? What do we need to know? The side effects of digoxin, as we said, was ventricular fibrillation. But also I want to mention one thing, AV block, a total AV block. Because as we know, we have a heart here, and in the heart we have chambers, and in the atrium, right atrium, we have SA node, and then between here, in the middle, we have an AV node, and this AV node can be blocked. This is the nodes that are giving impulses to the whole heart. And if the impulse cannot go through this AV node because the digoxin is blocking it, then the heart cannot pump and you kill the patient again. As we said, digoxin effect is to reduce heart rate. And if you already have an AV block in a patient and you give a digoxin to this patient, then you can totally block the AV node, which means that you kill the patient. So digoxin, please watch out with this medication. This is not a joke. You need to watch out how much you give to this patient. Always start, as we said, with 0.125 milligram, and then you should not have any problems. Of course, there are other symptoms of digoxin. Nausea. The patient is nausea. He's vomiting. He is confused. If you see any of these kind of symptoms after you give digoxin, then please consider stopping it. Okay? Even eye problems like amblyopia can be seen. Even anorexia. So you see that the patient gets thinner and thinner. So these are very strange but important side effects that you need to remember. And in heart failure, in which we have, for example, two main types of heart failure. We have heart failure with reduced ejection fraction, R, this stands for reduced, and then we have heart failure with preserved ejection fraction. This is the P. So P stands for preserved, R for reduced. So in reduced ejection fraction, then digoxin can be used. But please never use digoxin in preserved ejection fraction. Please don't do that. It's very dangerous. It's not beneficial for the patient. Only use preserve when you have atrial fibrillation. I will not write it down because it's a long word. Atrial fibrillation, you can look it up what it is, or a severe right ventricular heart failure. This is the right ventricular, or these are the atrium. We have two atrium, this and that, and then we have right ventricle. If you have a right ventricular failure, then you can give it in preserved one, or if you have atrial fibrillation, then you can also give it in preserved one. So if you have an atrial fibrillation together with a heart failure that is preserved one, then you give digoxin, but not otherwise. Okay, if you don't see any atrial fibrillation, then only give it in reduced ejection fraction. And reduced just means that we have less than 40%. Here, preserved, this means that we have more than 50% of ejection fraction. And what is ejection fraction? Do you know what ejection fraction is actually? So if you have the heart here and you have the this is the left ventricle. The blood is going from the left ventricle through your whole body. Okay? And the volume here, for example, if you have this is blood. If the volume of blood here in the left ventricle is pumped, then you calculate how much percent of this volume was pumped. So let's say you see this heart, let's draw another heart and compare it. If, for example, only this amount is left, then you compare how much was reduced. And if you see that it was more than 50% ejection fraction, then it's preserved one. If it's less than 40, then it's reduced one. And how can you calculate it? You cannot look at the patient and tell you that's how much we have. No, of course you need to have some tools. And which tools do we have? Echocardiography. And with that you can check all these levels. So please remember that. That's a very good tool to use in heart failure patients. It's called echo. I will just write echocardiography. Okay, this is an ultrasound probe that you put on your heart, and then you can see everything very, very clearly, all the ejection fractions. So, digoxin, please remember that digoxin is only there to treat the symptoms and not to prolong the life of the patient. Always remember that kidney is the organ that the digoxin gets excreted through. That means that if you have a bad kidney, then the buildup of digoxin will quickly happen, which means, because we have a narrow therapeutic index, that you can increase it too high the dose and you get toxic effects, which means that you get ventricular fibrillation, AV node block, and you kill the patient. So remember that you get the patient, you ask if he has any kidney disease, you look at the chart, even if he does say that, no, I don't have kidney disease, then please look at the chart anyway. Look at the previous letters of other doctors, and then you see that yes, or look at the lab values, or most important, you take a lab value and check this, and then you see that the kidney is functioning well, then you can give digoxin. If it's not, then please reduce the dose as much as possible. Only give a very, very low dose then. If not, then you can increase it. So the other thing that is that women compared to men also have also have a higher doses, because the lean body weight usually of women is less, and digoxin is calculated compared to how large you are. And if you are a woman or you are having a very lean body weight, if you have bad kidney functions and so on, then these can all be very dangerous, because the doses can be too high. Okay, and remember, 0.125 milligram once a day, that's more than enough. Give that every day and you will see a you will see less symptoms of the patients. And the digoxin, as we said, will always lower the pulse, and if the pulse is too low in a patient, for example, the patient is already having a bradycardia, which means a too low pulse, then please don't give digoxin, because that will lower it further and so on. So I thank you very much for listening, and I think this was enough of digoxin. Thank you very much.